What do you know about thalassemia? Not much? Well, let's change that. Thalassemia is a genetic blood disorder that affects the body's ability to produce hemoglobin, the protein in red blood cells that carries oxygen. This can lead to anemia, leaving those affected feeling tired and fatigued. There are two main types of thalassemia: alpha and beta. Alpha thalassemia occurs when one or more of the 4 genes that make up the alpha globin chain are missing or altered. Beta thalassemia, on the other hand, happens when the body can't produce beta globin chains. Symptoms can vary greatly. Some people may show no signs at all, while others may experience severe anemia, growth delays, and issues with the spleen, heart, or bones. Understanding thalassemia is the first step towards demystifying this condition. Now that we've shed some light on what thalassemia is, it's time to take a look at what it's like to live with this condition. Imagine living with a chronic illness that impacts your daily life. This is the reality for many individuals living with thalassemia, a genetic blood disorder. Let's hear from some of these brave individuals. Mira, a college student, shares, "I have to plan my day around my treatment schedule. It's tough, but it has taught me discipline and resilience." She uses a structured routine to manage her condition. Next, we have Raj, an entrepreneur, who says, "I need frequent blood transfusions which can be disruptive, but I've learned to see it as a necessary break, a time to pause and recharge." He adopts a positive mindset as his coping strategy. Lastly, we have Priya, a mother, who tells us, "I always worry about my kids inheriting thalassemia. I educate them about our family history so they're aware." She believes in the power of knowledge and awareness. Living with thalassemia can be tough, but awareness and understanding can make a world of difference. Unfortunately, there are many myths surrounding thalassemia. Some believe it's contagious, but let's set the record straight. It's a genetic disorder, not an infectious disease. Another misconception is that it's a childhood disease, while in reality, thalassemia can affect individuals of any age. Also, it's not true that if you have thalassemia, you can't lead a normal life. With proper care and treatment, individuals can lead full and productive lives. The more we know, the better we can support those living with thalassemia. Thalassemia is a genetic condition, but how exactly is it passed down? Well, let's delve right into it. This blood disorder is inherited, meaning it is passed down from parents to their children through genes. Thalassemia is not contagious. You can't catch it like a cold or flu. It's all about the genes you receive from your parents. When both parents are carriers, there's a 1 in 4 chance in every pregnancy for the child to be born with thalassemia. It's a game of genetic roulette, if you will. And it's not just about having the disease or not. There are varying degrees of severity based on the specific genetic makeup inherited. So, to sum it up, understanding the genetics of thalassemia can help in early diagnosis and management. It's all about knowing your family's health history and taking proactive steps. So what treatment options are available for those with thalassemia? Well, there are a few paths one could take. The most common treatment option is regular blood transfusions. These transfusions help maintain a healthy level of hemoglobin and red blood cells in the body. However, they also lead to an excess of iron in the body, which can be harmful. This is where iron chelation therapy comes in. It's a treatment that helps remove the excess iron from the body, typically administered through an injection or oral medication. It's an essential part of managing thalassemia, but it does require strict adherence to the regimen. Lastly, there's bone marrow transplant, a more permanent solution. This procedure replaces the patient's faulty bone marrow with healthy marrow from a compatible donor. It's the only treatment that can potentially cure thalassemia, but it's not without risks and complications. While there's no cure for thalassemia, these treatments can help manage the condition effectively. To gain a deeper understanding of thalassemia, we've spoken to a specialist in the field. Thalassemia is a complex disease requiring a multifaceted approach to diagnosis and management. The specialist emphasized the importance of early detection, often through prenatal and newborn screening, to begin treatment as soon as possible. Management strategies may include regular blood transfusions, iron chelation therapy, and in some cases, stem cell transplantation. But it's not all about the present. The future of thalassemia research is promising, with advancements in gene therapy and personalized medicine on the horizon. These could potentially reduce the disease's burden and improve the quality of life for those affected. With ongoing research and advancements in medicine, there's hope for a better future for those living with thalassemia.